Okay, let me start with something really stark. What if I told you that in the time it takes you to listen to this deep dive, maybe 6 Americans will have died from conditions directly linked to obesity?
Wow. Yeah.
And what if your health, your real health outcome, wasn't mainly about your doctor visits, but actually your ZIP code?
That's a provocative idea mentioned in the sources, yeah, where you live impacting your health more than genetics.
Or even this, that maybe, just maybe, the food on the fast food menu board is, well, responsible for more deaths than what you might find in a gun cabinet. Okay, let's dive into this.
Let's do it.
Welcome back to the deep dive. So we've got this significant stack of source material you've sent us, articles, research, analyses, all focusing on what many are now calling America's obesity crisis.
Hmm.
And we're taking all these sources, everything you've shared, and really digging in, trying to unpack the root causes, the consequences, and what paths forward are actually being discussed.
And right from the start, from the very first pages of this material, there's this central question that just jumps out. It kind of frames the whole discussion.
Yeah, what's that?
In the face of this crisis, are individuals fundamentally failing? Or are they being failed by the powerful systems that surround them?
That question. Yeah, it really does hang over everything we read. And the scale of what we're talking about is, frankly, it's hard to wrap your head around.
It really is.
These sources are reporting that over 40% of American adults are currently living with obesity. Just think about that. That's getting close to 100 million people.
100 million. It's not some niche issue. It's like woven into the fabric of the population.
Exactly. And one of the most startling things, I think, across these sources is the rate of increase, especially in kids.
Oh, absolutely. We're seeing stats that childhood obesity has tripled since the 1970s. Yeah, tripled. That's a huge shift in just a few decades.
Right.
It impacts an entire generation and, the ones coming after. It tells you this isn't just about adults making choices. Something fundamental has changed in the environment.
And let's be super clear here, because the sources hammer this point home again and again. This is not about body image or how people look.
Not at all.
Obesity is highlighted as a leading risk factor for just a cascade of severe, often debilitating diseases.
Yeah, we're talking significantly higher risks of heart disease, stroke, type 2 diabetes. Some papers even call it diabesity.
Diabetes, right.
Certain cancers, infertility problems, severe sleep apnea where you literally stop breathing at night. It's serious.
The human cost is just immense, but sources also point out the economic cost.
Yeah.
Which is also staggering.
Yeah, the estimates cited are upwards of $170 billion annually in direct medical costs tied to obesity. And when you combine that with the fact that 1 in 5 kids in America today are obese, well, some of these articles, they don't shy away from calling it what they see it as, which is a national emergency. It's draining the healthcare system, impacting long-term health, productivity, the works.
So, okay, if it's this widespread and it's accelerated this quickly and it's hitting kids so hard, can we really just boil it down to individual willpower?
Well, the sources you've provided argue pretty strongly against that simple view.
Yeah, it seems like it.
They contend that while, yes, personal choices are involved, those choices are profoundly influenced. Some sources would even say dictated by the environment a person lives in.
So what are the big forces then? What do the sources say is, like, stacking the deck?
Well, one factor that comes up constantly is the omnipresence and the nature of ultra-processed foods.
Right, these aren't just convenience foods.
No, the sources describe them as engineered products. They're incredibly cheap to make, super profitable, and they're specifically formulated to be hyper-palatable. Basically, really tasty and, yes, addictive.
Addictive.
They hit that perfect bliss point sugar, fat, salt that makes them really hard to stop eating, but they often lack the nutrients that actually tell your brain you're full, and they are just everywhere.
Just a constant onslaught. And our lifestyles have changed so much too, haven't they? The sources talk a lot about the rise of sedentary living.
Oh, yeah. More office jobs, sitting in long commutes, spending hours in front of screens, phones, computers, TVs.
Our daily routines just involve way less physical movement than they used to, even just a generation or two ago. I read one piece that said the average person takes thousands fewer steps a day now.
Thousands. And then there's another layer. Chronic stress and not enough sleep.
Ah, yeah, stress and sleep.
The sources really highlight this. When you're constantly stressed or sleep deprived, your body's hormones get thrown off. Cortisol levels specifically tend to spike.
And cortisol, that does what again?
Well, the sources explain that high cortisol is strongly linked to increased appetite. especially for those high-calorie processed foods we just talked about. And it also tells your body to store more fat, particularly that dangerous visceral fat around the organs. It creates this really vicious cycle.
Wow. Okay. And this brings us back to that stark idea you mentioned, your ZIP code being more important than your genetic code.
Exactly. The sources detail how millions live in what they call food deserts or food swamps.
Right. Areas where healthy food is hard to find or afford.
Precisely. Often low-income areas, urban or rural, where access to affordable fresh produce and healthy groceries is limited, maybe non-existent, but fast food places, convenience stores, selling processed snacks, liquor stores, they're everywhere.
So if the only food you can easily walk to, or the only food you could afford on a tight budget, is ultra-processed and high-calorie, is choosing it really a free personal choice?
That's the core question the sources raise. They argue the environment basically pre-selects the options for many people.
And those options are pushed on us constantly.
Relentlessly marketed, yeah. The sources point to the sheer power and budget of the food marketing industry, over $11 billion.
$11 billion.
They detail how this industry uses sophisticated psychology, specifically targeting vulnerable groups, especially kids, through ads, product placement, partnerships.
I remember seeing one mention about cereal boxes with cartoons placed right at a kid's eye level in the grocery store aisle.
Exactly. It's not subtle. It's a calculated effort to shape preferences and habits from a very early age.
So you put all these pieces together.
Yeah.
The engineered food, the sedentary lives, the stress, lack of sleep, the environmental limits on food access, the nonstop marketing. The picture that emerges from these sources is, it's like individuals are trying to navigate an environment almost designed to promote weight gain.
That's precisely the argument these sources are making. They aren't saying individual agency doesn't matter at all, but they are forcefully stating that the context, the system, the environment, it plays a vastly larger role than we usually acknowledge. It's a really powerful reframing.
It really is.
Yeah.
And when these factors combine and weight issues really take hold, the consequences, well, the sources detail how far-reaching they are, way beyond just physical appearance. What are the specific health impacts they keep emphasizing?
The physical toll is huge, and it just compounds over time. We already mentioned the higher risk of heart attacks and strokes.
Right.
The sources get into the mechanics, how excess weight strains the heart, raises blood pressure, messes with cholesterol.
Yeah.
Then there's that critical link to type 2 diabetes.
The diabesity thing.
Exactly. Excess body fat, especially abdominal fat, leads to insulin resistance. Your cells stop responding properly to insulin, blood sugar rises, and boom, diabetes, which then leads to nerve damage, kidney damage, vision loss, poor circulation. It's a whole cascade.
And it affects just moving around too, right? Daily life stuff.
Absolutely. Reduced mobility is a constant theme. Often comes with chronic pain, especially in joints like knees and hips, just from carrying the extra weight.
So simple things.
Simple things most people don't think twice about. Climbing stairs, bending down, tying your shoes can become incredibly difficult, sometimes impossible. It's not just discomfort. It severely limits your independence, your quality of life.
And it's not just physical, is it? The sources talk about the mental health side too.
Oh, heavily. They underscore the significant mental health impact. Higher rates of depression, anxiety, directly correlated with obesity. It seems to stem from a mix of biological things, inflammation, hormone changes, and just the huge psychological burden of living with a chronic condition.
Plus the stigma.
Plus the persistent, often cruel social stigma that can lead to isolation, shame, and just make mental health struggles even worse.
That combination, physical limits, chronic illness, mental health challenges, it must be an incredibly heavy load to carry. Every single day.
It is. And maybe the most sobering stat that pops up again and again in this material is the impact on lifespan.
How bad is it?
The sources consistently state that individuals with obesity face a 50 to 100% increased risk of premature death compared to people at a healthy weight.
50 to 100%. Doubling the risk.
Doubling the risk in some cases. It just highlights the profound, life-shortening consequences.
So this deep dive into the sources, it paints this picture of a crisis that's massive, worsening fast, driven by these powerful systemic and environmental forces. And the result is severe physical, mental, and economic harm, ultimately cutting lives short.
It really touches every part of a person's life: health, mobility, emotions, social life, finances, everything.
Yeah.
It's a multifaceted crisis that needs a much more nuanced understanding than just, blaming individuals.
Okay, so After absorbing all that, the scale of the problem, the complex factors, the heavy consequences laid out in these sources, it could feel pretty overwhelming, maybe even hopeless.
It definitely can.
But the sources don't just leave it there, do they? They pivot. They offer insights, potential paths for managing things, for change. So, drawing from this material, what strategies, what solutions are actually discussed? What can people grappling with this do based on this research?
Yeah, this is where the focus shifts from the problem to the possibilities. And while they fully acknowledge the systemic hurdles, they also highlight approaches that have shown promise for individuals. Lifestyle modification is, like, foundational.
Right. Diet and exercise.
Yes. But the sources really emphasize a crucial point. It's about sustainable change, often starting small, really small.
Starting small.
Yeah.
Yeah, that really stood out to me too. They gave simple examples like maybe just adding 30 minutes of walking into your week, even if you split it up 10 minutes here, 10 minutes there.
Exactly. Or committing to cook just one more meal at home each week instead of eating out. Or focusing on getting just 30 minutes more sleep a night. The idea isn't some massive radical overhaul that's impossible to stick with.
No, it's more like building new healthy habits gradually. Establishing a new rhythm, they called it.
Right. A sustainable rhythm. And behavioral therapy comes up consistently, too, as a powerful tool. Specifically, cognitive behavioral therapy, CBT.
How does CBT help with weight?
Well, the sources explain it helps people identify the thoughts and feelings that trigger unhealthy eating or maybe avoiding activity. It gives you strategies to challenge that negative self-talk, reframe how you think about food and stress, and develop coping mechanisms that don't involve turning to food. It gets at those psychological layers.
Makes sense. What about support systems?
Also highlighted as really effective, things like joining local fitness groups, community wellness challenges, even just finding a walking buddy. That social support, the shared goals, it provides accountability, motivation, and helps reduce that feeling of being isolated in the struggle.
And the sources do acknowledge medical options too, right, for some people?
Yes, they do. They acknowledge that for some individuals, especially those with significant health complications already, medical options might be necessary parts of a treatment plan.
Like medications or surgery.
Exactly. Working with doctors to explore FDA-approved weight management meds, which can help with appetite or metabolism, or in some cases, considering bariatric surgery as a tool for significant, sustained weight loss when other methods just haven't worked. But the sources stress these aren't standalone fixes.
Right. They're part of a bigger approach under medical guidance.
Precisely. It was also interesting, as you said, that the sources touched on certain FDA-approved natural supplements, noting their potential role when used responsibly to support metabolism or appetite regulation. Again, reinforcing that none of these are magic bullets, just potential tools in a bigger strategy.
And crucially, the goal of all these strategies,
Yeah.
the sources emphasize it's not about chasing some specific body type dictated by magazines or social media.
No, it's framed entirely in terms of health outcomes, reducing the risk of those devastating diseases we talked about, living longer, improving mobility so you have less pain and more independence. Ultimately, just feeling more capable and, as one source put it, free in your own body.
Free in your own body. I like that. It shifts the focus from external judgment to internal well-being, doesn't it?
Completely.
And one point in the material that really hit me was the insight that many people just didn't know these options existed for them.
Yeah, that was powerful.
They hadn't been offered structured strategies or comprehensive support. They'd sort of internalized the idea that their weight was their identity. Just a personal failing, not a complex condition, influenced by all these factors that they could potentially manage with the right help.
Yes, that feeling of being stuck, like it's just an unchangeable part of who you are.
Right.
That's a huge barrier.
So to you listening right now, taking all this in the stats, the challenges, the potential pathways, please take this message from these sources to heart. You are not your weight.
Absolutely.
You are not fundamentally broken or failing. More likely, you're busy, you're tired, you're stressed, or you're navigating an environment that makes healthy choices incredibly tough. You need understanding and support, not shame or blame.
It's about recognizing those powerful external forces, understanding them, and knowing that there are evidence-based strategies that, yeah, they're challenging, but they can make a difference when you have the right knowledge and the right support.
So if anything we've talked about in this deep dive resonated with you, maybe the most powerful first step, like the sources suggest, is incredibly small. Just pick one tiny change. Focus on it this week. One extra walk around the block. Swap one sugary drink for water at lunch. Take 5 minutes to look up one healthy, affordable recipe online. Or just read one food label before you put something in your cart.
Change doesn't need a massive, overwhelming revolution overnight. It's about finding that sustainable rhythm, right? One manageable step then another, building momentum.
This deep dive.
Yeah.
Wow. It's really laid bare the complexity of America's obesity crisis.
Mhm.
It's powerful, sometimes uncomfortable, seeing how individual biology, personal habits, and these profound, often invisible systemic forces all intersect.
Yeah, forces that shape our lives in ways we rarely even stop to think about. It really compels you to look beyond the surface, question the simple narratives we've maybe accepted. It highlights just how deeply our health is tied to the environments we live in.
It absolutely does. And it leaves us with this thought, maybe something for you to consider this week. Given how profoundly our environment and the systems within it shape the choices actually available to us, what does personal responsibility truly mean when we're facing a public health crisis driven by forces so much larger than any single individual?